The title that we chose for the conference this year is Understanding Thoracic Aortic Disease. That is a very ambitious title. But for those patients and families that live with it, it's not just understanding, it is living with thoracic aortic disease. The foundation has a goal of balancing, a very difficult balance, and it is the balance that those who have the disease and those who love them, they live with this every day. First of all, we want to remove some of the mystery, and there's some simple concepts that we can use to help with that. Increase understanding about thoracic aortic disease, highlight the challenges that everyone, including the physicians who help us, face, and maintain a positive approach to a potentially devastating condition. I'm just going to ask Carrie Mettler to come up and say a few words about her life with thoracic aortic disease.
I'm really glad that my surgeon is in the audience because I'm very nervous right now. And I know it's not good for my blood pressure, but I am really honored to be here today. It's a privilege to be associated with the Bicuspid Aortic Foundation. And like I said, I'm really lucky in many ways. My experience as a heart patient began 21 years ago at the age of 30 when I received my first pacemaker for something called sinus node dysfunction. I was always really athletic, and it was unexplained to me why I was passing out. I'd just feel terrible and pass out. And of course, every time you go to the doctor, it's not going to happen. Every time you wear a monitor, it's not going to happen. Till one day when I just felt terrible. I felt like I was going to die. I told my roommate, I says, I think this is it. And I passed out on the way to my bedroom, and they took me to the hospital at a heart rate of 16. So I ended up with a pacemaker. Well, it kind of changed everything for me, and I got interested in cardiology. I went to work at the office where I was a heart patient, and it was about 1993, and our echo tech received a brand new state-of-the-art echo machine. She said, "Hey, Carrie, I want you to be my practice patient." It's like, "Oh, okay, sure." Because it was known that I had a murmur, but we always thought it was an innocent murmur. I knew something was up because she was just acting not herself. And she finished the test. I says, "Everything okay?" Yeah, I'm going to let your doctor take a look at it. And he cornered me a couple days later after she kept asking me if I'd talked to my doctor. And he says, "Yeah, you have something called a bicuspid aortic valve." So it was just by a fluke that I found out about this. And we monitored it. It like one of the slides that you were looking at before, it was functioning normally. It very trace amount of regurgitation or insufficiency, I should say. And we just thought, okay, I'm going to be all right. Well, my little sister started having some problems, palpitations and some strange symptoms. And I said, well, maybe you better have an echo. Well, they went ahead and did a CT scan, and she had a bicuspid aortic valve, and she had a 6-centimeter aneurysm on her aorta. So that all kind of snowballed, and she ended up having to get a pacemaker as well when she had her aneurysm and her valve replaced. They got too close to the little natural AV node in her heart. So with that, my cardiologist said, we better take a look at your aorta. So I'm one of the lucky ones where my aorta is really, we can see almost the whole thing on echo. And it's a godsend because I cannot have an MRI because of my pacemaker. But sure enough, I had an aortic aneurysm, and to this day it's remained relatively stable. But I have my regular checkups and stuff. But that wasn't the end of it for me. I kind of got back into my life. I've always been active, athletic, running races and done a lot of different things. But I started to having this strange ringing in my ear and some feelings, again, almost like I did before I had my pacemaker put in. I just feel really bad. And prior to this, I got a little ahead of myself. I met Arliss and came down here and saw Dr. Racy. And she came across an article that Dr. Shevink had written about patients that have bicuspid aortic valves and ascending aortic aneurysms having brain aneurysms. So she got the ball rolling, and I went to my general doctor. They told me, well, you need to come, or you can have a CT scan. They were just kind of like, nothing's wrong with you, it's all in your head. So I had the CT scan and it was normal. I called Arliss and she said, no. She called Dr. Racy. Dr. Racy called Dr. Shevink, who published this article, and he said, no, she needs to have it with contrast. So I just kind of said, forget it. I'm going to LA. Arliss picked me up. Bottom line was, I went into his office after all my tests and I sat down. He came in and told me I had an aneurysm in my brain behind my left eye. You can imagine how that feels. I mean, it's so surreal. It's like, I thought, surely I've had enough. How can I take more? But Dr. Shevink was wonderful. He grabbed my hand. He reassured me that we were going to be okay and let me go on my way back up to my hometown. He said, I want to take a look at things. We'll figure out if we need to do surgery. And called me the next day. But prior to that, every time the phone rang, I'd jump out of my chair like, oh, I'm going to get the call. And he did tell me that I needed brain surgery. So I said, you schedule the first available. I don't want to be sitting on this. It'll consume me. So this was exactly 1 week before Christmas, I found out, in 2003. And I had my surgery in 2000, or that January of 2004. I got up, dusted myself off. I was back running on the beach in Hawaii in March. So I think for me, and what I try to do with my life is balance everything. I'm a little overextended right now, but I still think I'm balancing it. I've got a little winery with my husband. I'm on the board of directors for the foundation. And I work at Stockton Cardiology, where I manage their pacemaker and ICD clinic, as well as fill in for other diagnostic tests. And I love it, but it's balance. You work with your doctors, you ask them what your limitations are. My cardiologist actually had me on a treadmill. We monitored my blood pressure. I wear a heart rate monitor when I exercise so I can make sure I keep my heart rate at a certain level. But I think it's important to have that balance and stay fit instead of, I think you can get so consumed by sitting around and worrying about it all the time. I mean, there's a place for worry. Every time I go in for a test, that's the time I worry. It's like, okay, what are they going to find now? But it's important to try and live your life.